Hi, my name is Victoria Scharff. I'm the PA student doing your evaluation today. Do you mind confirming your name and birthday for me?
Samantha Scharff, 3/17/99.
Perfect. And for the purposes of my school, do you mind just saying that I have your consent to send this to my school?
Yeah, my consent.
Okay, great. And for inclusivity, I just want to tell you that my pronouns are she, her, and hers. Do you mind sharing me with your pronouns?
She, her, hers as well.
All right, perfect. So we're just going to start and assess your cognition, your memory a little bit today. So first, what's been going on since our last visit? What have you been up to?
So I'm a little bit of a way through my second semester of PA school. It's getting pretty stressful, but
I bet.
yeah, it's very stressful if you've been there. So I'm just trying to do things that reduce my stress when I can, just kind of in between exams. So.
Good. How's that going?
I'm doing my best. I probably could make a few changes and allow myself a little bit more time.
Yeah.
But a lot.
Figuring it out.
Yeah.
Good. So while she's speaking, I'm assessing her. She's alert and oriented. I'm noting if she's not comatose, obtunded, stupor, anything like that. She's alert, and I'm noting that she is sitting upright. She's not slouched over. She's not gripping anything. So her body posture is good. I'm noting any body movements, her motor behavior, if she has abnormal tics, any spasms, any asymmetry of the body sides. And I'm just noting her facial expression. I want to know if she has any signs of masked faces or any pathologic facial expressions. Also, if she's angry or hostile or upset, anything like that. And I want to note that her dress is appropriate for the weather and her age, the occasion. I want to know if she's favoring one side of the body over the other. And I don't smell any abnormal odors or indications of poor hygiene. So now we're going to move on. We're just going to assess your speech a little further. While I'm listening to her speak, I'm listening to her volume of speech, if it's loud or low, to the rate of the speech, if it's very quick or if it's slow, catonic speech. I'm noting the fluency, if she has any hesitations, paraphasias, circumlocutions, and I'm noting if she has any hesitancies in the speech. And if she were to have abnormal speech at all, I would do further testing. So first, I'm just gonna do some comprehension testing. So I'm gonna have you point to your nose, and then I'm gonna have you point to your nose, and then your knee. Good. And then I'm just gonna have you repeat after me. No ifs, ands, or buts.
No ifs, ands, or buts.
Great. And then I'm just going to have you name the pieces of a watch.
Okay, so you have the wristband,
Mm-hmm.
You have the watch itself with the glass covering, you have the numbers, and then you have the minute hand and the hour hand.
Great. All right, and then I'm also assessing my patient's manner, her affect, and her relationship to myself, to other people in the room, to other things. So I'm noting that she's open to the conversation. She's not closed off. We're having a good conversation. She's not trying to keep it very short or anything like that. So I'm also, when I'm noting her fluency, and if she had abnormal fluency, I would also do 2 further tests. I will write a sentence on this paper and it has a command on it, and I will expect you to read it and follow the command. Great. So I told her to fold the paper, and she folded it. So now I'm going to have you write a sentence on this paper. Great. And she wrote, "It's Friday." So now we're going to move on to your mood and the pattern of your mood. How would you explain, like 3 words, how your mood is generally now?
If due to stress, I'm pretty anxious most of the time, especially because of school. My memory problem's been making me a little bit depressed. It's just making me a little frustrated because studying isn't really, beneficial to me.
Yeah.
So I would say I'm frustrated as well.
Okay, yeah, that makes sense. And she did mention that she's feeling a couple of feelings of depression, so I would further evaluate the PHQ-9, her with the PHQ-9 questionnaire, and know any risk of suicide. And I'm also going to note that, do you have any fluctuation with your mood throughout the day, or is it pretty constant throughout the day?
I want to say, when I have a lot of schoolwork to do, it kind of fluctuates. It gets a little more intense. But if I'm not doing anything and I can relax, it kind of goes down.
Okay, great. So I'm noting if her mood is labile or stable, changes quickly or not. And I'm also now going to evaluate your thoughts and your perceptions. So tell me a little bit about school. What's going on this semester?
We're taking a lot of classes. We're starting clinical med courses, so we're taking cardiology right now. We're taking rheumatology, which I'm interested in, pediatrics, and some other classes that are very
cool.
content heavy. So.
All right, cool. So which classes? What's your favorite and which is your least favorite?
I like pathophys.
Okay.
I think it's interesting learning about the body. My least favorite right now is probably peds.
It's difficult.
Yeah.
It's like a whole new subject.
Oh yeah, for sure.
Yeah. So her insight's good. It makes sense with what she's going through at this moment. And now, if you found out that your peds test that's supposed to be in a week got moved to tomorrow, how would you handle that?
Well, I would study as much as I can today for as much as I have time. I want to make sure I have a good night's sleep, so I'll get as much studying as I can without overdoing it, and then just rely on what I can retain and what I remember. So
good. All right. Yeah, good. So she has good judgment, no irrational thinking or impulsivities. And now we're going to test your cognitive functions a little bit. So can you just let me know that you're alert and oriented by telling me your full name, where you are, and the date?
Okay, so my name is Samantha Shellcross. We are at Touro University, and today is June 16th.
Great. So the patient is A&O times 3. And now I'm just going to see how your attention is. So I'm going to give you 5 numbers. They're the zip code of Middletown, 10940. And I'm going to ask you to repeat that back to me.
Okay, 10940.
Great. And now we're just going to do a little math. I'm going to have you start at 100 and subtract 7 until I tell you to stop.
Okay, 100, 93, 86, 79, 72, 65.
Okay, you're good. All right, good job. So now we're going to do you're going to spell world for me.
WORLD.
Good. And can you spell that backwards for me?
DLROW.
Perfect. Okay, great. So cognitive functioning is good. And now we're going to move on to higher cognitive functioning. So while she's speaking, I'm evaluating the information she's giving me and her vocabulary that she's using. I'm noting that it's appropriate for her age and the subject of what we're talking about. And now I'm just going to have you calculate for me. So if you went to the store and bought a pack of gum for 60 cents and you gave the teller $1, how much change would you expect back?
40 cents.
Great. So now when somebody says not all that glitters is gold, how do you see that as abstract thinking?
So I interpret that as if something looks good on the outside, it might not always be good on the inside or in the long run. So you got to be careful what you think.
Yeah, perfect. And I'm just going to have you now draw a clock on here for me. Okay, good. Now I'm just going, and she wrote to a good, well-designed clock. So now I'm going to give you 3 words, and then we're just going to talk about a couple other things for a little bit, and then I'm going to ask you to repeat them in a little while, okay? So repeat these after me. Table, chair, wall.
Table, chair, wall.
Good. All right, so tell me a little bit about your family. Do you have any siblings?
Yeah, I have a younger brother that I live with, an older brother that does not live with me. My younger brother that I live with is 4 years younger than me.
Okay. So you're the middle child, the forgotten.
Yeah. Yeah.
Okay, good. Good. And so while you're memorizing these words in the background, this is an assessment of testing your long-term or your new learning ability. And I'm also going to ask you some questions that test your short and long-term memory. So can you tell me what we shared together for breakfast this morning?
I had an English muffin. I let you have half.
Yes, so I can confirm this because we shared it. And then can you tell me, I can see in your chart your birth city. Can you tell me your birth city?
Syracuse, New York.
Perfect. And so what are your brothers' names?
My younger brother's named Ethan. My older brother's name is Devin.
Okay, good. And do you remember those 3 words I gave you?
Yes. paper chair wall.
Good.
Yeah.
All right. Thank you for everything.
Okay, thank you.